Greetings, this is our heart anatomy simplified. On the screen in front of you, you see two circles. One is blue and one is red. The right atrium is represented by the blue circle on the left side of the screen, and the red circle represents the left atrium on the right side of the screen. So don't get those backwards. Then there are two ovals. The right ventricle is the blue oval, the left ventricle is the red oval. The right side of your heart is deoxygenated blood, and the left side of your heart is oxygenated blood. The lungs are in between because they are the ones that oxygenate that blood before it moves on to the body. Now let's talk about the valves between the atriums and the ventricles. On the right side, you have the right tricuspid valve. The tricuspid valve goes from right atrium to right ventricle, or the right atrioventricular valves. It's tricuspid because there are three different valves in that area. On the left side is the bicuspid valve or the mitral valve, and there are two flaps with this valve. So the memory jogger here is you have to try it before you buy it, because the tricuspid valve comes before the bicuspid valve. Now it's time to talk about blood moving to the lungs and from the lungs. We have the pulmonary artery. Remember that arteries take blood away from the heart, and blood is moving from the right ventricle away from the heart into the lungs. So that's the pulmonary artery, and it's the only artery that carries deoxygenated blood. They also move through the pulmonary semilunar. Semilunar sort of looks like a crescent moon. Semilunar valves. The pulmonary valve or the pulmonary semilunar valve controls blood flow from the right atrium to the heart. Then, when blood moves out of the lungs, it goes to the left atrium through the pulmonary vein. Through the pulmonary vein. Remember, veins go to the heart and is coming from the lungs to the heart and the right atrium, so it's the pulmonary vein. It is the only vein that carries oxygenated blood. Now let's talk about the other set of semilunar valves, and that comes from the left ventricle through the aortic semilunar valve, because this blood is moving to the aorta, so it goes through the aortic semilunar valves to the rest of the body. Things that help the tricuspid and bicuspid valves work are the chordae tendineae. And we know that tendons hook muscles to their attachment sites. So these chordae tendineae are hooked to papillary muscles inside the heart to help them work. Chordae tendineae hooked to papillary muscles to help the tricuspid and bicuspid valves work. All right, this is a nice short and simple video. So we're going to trace a drop of blood through the heart. We come into the right atrium through our vena cava, either superior or inferior. We move from the right atrium through the tricuspid valve to the right ventricle. Then we move from the right ventricle through the pulmonary artery and the pulmonary semilunar valves into the lungs. Then from the lungs, we move through the pulmonary vein to the right atrium. Then from the right atrium, we go through the bicuspid or mitral valves into the left ventricle. And then we move from the left ventricle through the aortic semilunar valves into the aorta and to the ascending aorta and the rest of the body. Hope this helps you break down the heart anatomy, and this is the most simplistic terms. Have a great day.